Now.
Morning, ma'am.
Good morning.
Okay, so as we know, regarding today's, we are organizing about webinar on qualitative research methods. For that, I welcome you, ma'am. So welcome our today's honorable speaker, Dr. Anita Navle, ma'am, PhD nursing in community health nursing from Bharatiya Vidyapeeth College of Nursing, Pune. So we welcome you, ma'am, on the behalf of Par University. So, firstly, I small introduction regarding today's our speaker. So, ma'am is having a master degree and PhD qualification in community health nursing. Ma'am is also having a 19 years of experience in nursing profession and some special achievement by ma'am. So, in the 2017, a appreciation awarded by Parivartan Alumni Association for receiving a highest degree in PhD nursing in the 2015 to 16 Best Educational Award by the TNI Pune City branch and 2011-12 a Best Researcher Award by the TNI and Pune City. And regarding the publication, ma'am is also having a total a 19 national and international publication of well-known journals, and also ma'am is also contributor in the many more books, more than 5 books. So, ma'am is also having a research guide for the UG, PG, and PhD scholar. Ma'am is also have been part of workshop and international and national conferences. So, and also ma'am is also a member of IEC and nodal officer of All India Survey of Higher Education and National Institutional Ranking Framework. So now we welcome you, ma'am. So now without further wasting of time, I hand over the session to ma'am for the qualitative research method. Thank you, ma'am.
Good morning, Nirima. Thank you for the nice introduction. Good morning to one and all. First of all, I would like to thank the Paroli University Management and Dr. Ravindra, Principal Paroli Institute of Nursing, Vadodara, Gujarat, for giving me this opportunity to share my thoughts and present this topic on qualitative research design. So, we'll just share the screen and then I will start the topic. Is it visible, Nilima?
Uh,
Is it audible, visible?
yes, audible, ma'am. Please share the screen. After that, I
Yeah,
will.
yeah.
Yes, ma'am. The PPT is visible.
Okay.
Yeah, okay.
So we'll begin with the topic qualitative research design. Qualitative research seeks to answer the questions about why and how people behave in the way that they do. It provides in depth information about the human behavior. Just to know how it is different from the quantitative research, we'll see that first, and then you'll understand why I have written this particular statement. How the qualitative research seeks to answer the questions about why and how of the people's behavior. So just to know the difference, quantitative and qualitative research, we'll see few points which are important. First is general nature. If you see the quantitative research design, it is objective approach, and in qualitative it is subjective approach. Now, what is the difference between objective and subjective? Objective, as you know, we use these terms in a nursing process also. Objective means it is observable, measurable. So in quantitative research, we always observe and measure. For example, we observe the height, weight, blood pressure, temperature, etc., and we measure that. Whereas in subjective approach, that will be explained by the person who has experienced. So here we expect that the person will tell you what it means for him. Like for example, depression. In quantitative, you may call it as a mild, moderate, severe, but in qualitative, that person will explain you what it means for him, what is depression for him or her. So that is objective approach and subjective approach. Next is aim. In quantitative, to identify and count the variables. Here what we do, we have everything in the form of figures. We count it. If we, for example, if we are talking about the demographic variables, for example, age, for example, gender, then what we do, we count how many females, how many males. Whereas in qualitative, to collect the detailed description of the variable, here we collect the detailed description of that particular variable. For example, if we are talking about the depression, as I said, if we are in a quantitative design, we have to count how many patients are having depression. Whereas in qualitative, we have to have the detailed description of the depression, what it means by first person, second person, third person, whether it is similar or whether it is different for them. So that way we need a description. In planning, all aspects are carefully designed before the data collection. As you know, quantitative research, we plan everything from the beginning. We prepare the proposal or synopsis where you plan whole methodology, and you just follow the same methodology throughout the research process. There is no change made after that once you have prepared the proposal and it is approved by the ethical committee. Whereas in qualitative, it is not so. The design emerges as the study unfolds. This is very, very important aspect in a qualitative research design, where you don't have to decide previously, or you cannot have the fixed ideas about the design. It will be coming up as it goes through that process. In quantitative, sample size is always large and we try to generalize the findings. Whereas in qualitative, we have a smaller sample size and we cannot generalize the findings. Then data, numerical data is easier to collect and facilitate the hypothesis testing in quantitative research design. Whereas in qualitative, it will be in textual form, time consuming and less generalizable. Textual form in the sense, it will be in the form of narration. So it will be in the form of narration, that is textual form, and you need to use the different ways of analyzing it. Next is tools. Structured or semi-structured tools are used in quantitative. For example, you know that we use the questionnaire, we use the Likert scale, we use the observation checklist, etc. Whereas in qualitative, you cannot have the fixed methods of measurement or the tools. Here we need unstructured and open-ended questions where the participants will tell you his experience in detail. Analysis in quantitative we do in a descriptive form, or the inferential statistics. We use mean, median, mode, then chi-square, then we use t-test, etc., where you have calculations. Okay, so that is done in quantitative. Whereas in qualitative, we do not use these methods. We use coding, indexing, narrations, diagrams, etc. So there is a difference between the quantitative and qualitative research design. In quantitative, we more focus on the numbers, more focus on the generalization. We more have a fixed research methodology. We have a very objective kind of research tool to measure, whereas it is just opposite in a qualitative research design. Now next we'll see that is characteristics of the qualitative research design. Now what are the characteristics? First, as I told you, it is emerge as a study advances. We do not have a fixed research methodology which is pre-planned, which occurs in quantitative. Whereas in qualitative, as you go through the process itself, you will decide what kind of method you should use for the data collection, which is more comfortable, which gives more information, etc. So it emerges as you pass through that process. Next is flexible and elastic. As I told you, quantitative has got fixed method of data collection. You have questionnaire, you have fixed number of questions, and you have alternatives given to that, and the person has to choose from that. So no options for the person. So whereas in qualitative, it is flexible and elastic. If you find that you can take a in-depth interview of that person, you will go for that. If you feel that I need some more observation about it, then you can observe that person indirectly. So you have a flexibility and elasticity for data collection methods. Then multiple strategies of the data collection. As I told you, we are not depend on one particular method of data collection. Here we can use the multiple methods of data collection for the qualitative research. holistic. Here we consider the whole event as a one picture. Here we do not take only one part of it. In quantitative, you take only one aspect of the disease condition, or one aspect of the sign and symptom, or one aspect of the treatment, etc. Whereas in qualitative, you have to take that patient as a whole picture. So it is comprehensive. Next is intensive involvement of the researcher. In quantitative, what you will do, you can have the assistants with you. You can tell that assistant that go and collect the data from the particular participant. You can take help of the research, this what we call the trainers. But in qualitative it is not so. The researcher himself or herself is completely involved in the data collection. Researcher as an instrument, as I told you, in quantitative we use the different instruments, like we use the questionnaire, we use the checklist, we use the Likert scale, we use the observation tools which are standardized. But in qualitative we do not have. So researcher himself or herself becomes the instrument of data collection. That person is completely involved in the data collection process. Then ongoing data analysis. In quantitative, what we do, we first collect the complete data, and then we calculate the mean, median, mode, or we calculate the frequency, percentage of the demographic variables, or we calculate the findings at the end when you have complete data with you. Whereas in qualitative, it is not so. In qualitative research design, we have to do the analysis as we progress in the data collection. If you have collected the data from the first participant, start the analysis from that place itself. So your data analysis starts from the beginning only. Why? Because we do not calculate the total number of participants as one. We take them as one participant as one, second participant as a second. We cannot have the similarities always. So what we have to do, when we are doing the analysis, we have to find what is the perception of the first person, what is the perception of the second person. We have to compare them and find out the similarities and dissimilarities in them, and then we have to prepare the analysis codes and themes, etc. So it is ongoing data analysis. Next, we have that is qualitative research designs. We, there are few research designs which are used in nursing as well as medical profession. For example, phenomenology, ethnography, grounded theory, action research, case study, and historical research. I will be focusing more of practical points because theoretical points are available in all the books. You can read from that. Uh, my main intention is you should understand what it is. What is the basic concept of qualitative research design? So first one is phenomenology. The aim of phenomenological approach to qualitative research is to trace out precisely the lived experience of people and generate theories or models of phenomena being studied. The important point from this you have to know, that is it is a lived experience of the person, and it helps us to generate the theory or model. Now, characteristics of the phenomenological approach. Phenomenology tends to withstand the acceptance of those circumstances that are unobservable. This is very, very important characteristics of the phenomenology. Unobservable means what? For example, there are few parameters which you can observe, like temperature, pulse, respiration, heart rate, or you want to observe the ECG changes, etc. These are observable. But there are some parameters, like for example, emotions, feelings, depression, anxiety. These are not seen, which has to be told by the person who is experiencing that. So that unobservable events, how you can come to know? you can come to know through the phenomenological research when you talk to that person. So it helps us for that. Then the primary sources of data collection are the real life situations of the individuals being studied, wherein in-depth interviews, that is semi-structured audio taped interviews with participants, are the most common means for the phenomenology. In this, what we do, that is, we take a person who is actually experiencing that particular event. Furthermore, emerging themes are frequently validated with participants because their meanings of that live experience are central to the phenomenological study. What it means, in our quantitative study, we have two parts, that is validity and reliability, through which we say that whatever data we have collected is accurate. Whereas in qualitative, we do not have that. So what we do, we have a member check. That is one of the method by which we consider the validation and reliability of that particular data. That is, in qualitative research, we call it as a credibility and trustworthiness. So that is maintained by member check. So for member check means what? Member check means, you whatever you have collected the data, that you have to give it back to that person from whom you have collected, and you have to take the authenticity of that person. You ask that person whether whatever you have collected, is it true, or you have something else to tell from that, or you have some other meaning for that. So that is checked by from the participant, that is called membership. People who have recently had the experience are selected as a participants. Then bracketing is a technique used by the researcher to assess the participant. This is very, very important term used in phenomenology, that is bracketing. Bracketing means what? The researcher has got his own feelings and the emotions. You cannot mix that, or you have some basic knowledge or some assumptions. You cannot mix that with the data collected, which is from the participant. So here you have to bracket your all emotions, feelings, knowledge from the data which you have got it from the participant, and that you have to treat it as a separate one and analyze it. That is called bracketing. For example, just for your understanding, I have taken few examples. Theoretically, you may read everything from the book about the phenomenology, but you will not understand. So I'm just giving you one example how exactly this phenomenological study is done. This is one of the study recently done, a qualitative study on the psychological experience of caregivers of COVID-19 patients. In this study, what they did, using a phenomenological approach, they have enrolled the 20 nurses who were providing the care to COVID-19 patient. You know that when there was a outbreak, even nurses were scared to provide the care to the COVID-19 patient, because they were worried about their own family, their own health, etc. So this study was conducted, how they were coping with this particular situation in the beginning. So the interviews were conducted face to face or by telephone and were analyzed. Now the results showed that there were four themes emerged from this data, whatever they have collected. So results showed that first theme was negative emotions present in early stage, consisting of fatigue, discomfort, and helplessness, was caused by high intensity work, fear and anxiety, and concern for patients and family members. See how different it is from the quantitative findings. In quantitative, you might have told that these many nurses were undergoing the stress, and these were kind of the stress which they have experienced. But in qualitative research, you have to explain it in the textual form, what was the feeling and what was the common feeling which observed in them. So first feeling what they observed, that is negative emotions because of the fear and anxiety and high intensity work, etc. Second theme which they have received, that is self coping styles, included psychological and life adjustment, unselfish acts, team support, and rational reasoning. Slowly, nurses got adjusted with that, and they started coping with that stress by having unselfish acts. Means in the beginning, definitely everyone can be a selfish, that is a human nature. everyone can get scared of the disease because of the high death rate. After that they became unselfish, they started working, they started giving providing the appropriate care to the patient, started showing the compassion, there was a team support, they started working together, and there was a rational reasoning why we are doing this. Then third theme came, that is growth under the pressure, which included increased affection and gratefulness, development of the professional responsibility, and self reflection. So, slowly they started growing and they started feeling positive thoughts. And finally, it showed that positive emotions occur simultaneously with the negative emotions. So, this was a finding from the phenomenology. Phenomenology means the person who has experienced it. And who was that? The nurses who were taking care of the COVID 19 patients. They themselves have experienced and they have shared their thoughts in this particular research. Now, next research, this is a research done by me for my PhD, an exploratory study to identify the factors leading to suicide attempt among the college students in selected hospitals of Pune city. Now, the purpose of the study was to identify the factors leading to suicide attempt among the college students in Pune city. When I started my study that time, there was a very high suicide rate among the college students. So I had taken this study to find out why there is a high suicide rate. The method which I have used, that is phenomenological research, in-depth interviews were conducted with the students as well as their parents, and these face-to-face interviews were recorded using an audio recorder. And the data analysis resulted in the emergence of 7 distinct but interrelated themes with several subthemes, almost 30 subthemes which I have received, and from that I have prepared a model. You can see in this picture, this was a conceptual model which I have prepared from the data which I have collected. You can see here there are 7 themes, that is interpersonal conflicts, parental behavior, lover affair, lifestyle, family distress, academic factors. These were the common themes which I have collected from the data. And under that there were some sub themes which were different from the for the each participant. Like for example, if we take academic factors, so what is it included? Somewhere having the academic failure, somewhere having the behavior of the somewhere scared of behavior of the teacher, somewhere facing the problem in the college environment, and somewhere facing the problem with peer pressure. So each one had a different factor, and you can see it is overlapping. Why? Because there is no single factor, there is no single factor which was causing the suicidal attempt in the student. There are multiple factors in for the one student. So this was the model which has come out from the data which I got it from the students who had attempted suicide and got admitted in the hospital for the treatment. Once they recovered, after that I have corrected the data from them before they got the discharge.
Excuse me, ma'am. Sorry to
Yeah,
interrupt you, but slide is not changing, ma'am.
not changing.
No, no, no.
Now
Uh,
just check.
no, ma'am. It's only quantitative slides only. The picture is not visible.
Okay, I'll just check once again. I'll stop sharing and again I'll share.
Okay, okay, ma'am. Okay.
Is it visible now?
Yes, ma'am.
I'll just go back and again I will tell you.
Yes, yes.
In short, I told you about the qualitative research, how it is different. That is, it concentrates on why and how of the people behavior. Then I told you about the difference between the quantitative and qualitative research.
Yes.
Then I explain about the characteristics of the qualitative research design. Is it visible now?
Visible, but slide is not changing. Can you change one slide?
Yeah, I changed. I'm changing here.
But it's not showing. Okay, just next slide.
Now?
No, no,
No?
it's only in a one slide.
Okay.
Ma'am, please put slideshow mode.
Yeah, I had,
Uh-huh.
but it is not showing. Yeah, is it visible now?
It's visible. Can you change one slide?
Yeah, change. Is it changing? Is it changing?
No, no, no.
No?
It's only one.
Okay, I'll
Okay.
share one by one.
Fine. Okay.
Okay.
Then
Is it
continue, please.
visible now?
Yeah,
Characteristics of
visible,
qualitative research
visible,
design?
visible. Yes, visible,
Okay.
ma'am.
I
Okay.
have explained this now. Emergence as a study advances, flexible and elastic, multiple strategies of the data collection. It is holistic. It is intensive involvement of the researcher is there. Researcher as an instrument is used for the data collection, and ongoing data analysis is important for the qualitative research. These are the characteristics. Next, I explain about the qualitative research designs which are used in the nursing and the medical field, that is phenomenology, ethnography, grounded theory, action research, case study, and historical research. Next, I told about the phenomenology. It is about the lived experience of the people, generate the theories or models from that. Then I explained, is it visible now? Characteristics of the phenomenological approach. Hello?
Yes, ma'am. Now, yes, ma'am. Yes, ma'am. Now it is changed.
Okay. Then I will not
Okay.
put on the slideshow mode. Is it okay?
Yes.
Then I explain about the characteristics of the phenomenological approach. What is important in this? That is, unobservable things can be observed in the phenomenology. Then the primary source of the data collection are the real life situations of the individual in this. Then I told you about the emerging themes are frequently validated from the participant, that is called as member check. Then I explain about the participants. Who can be a participant? The participant is the person who has recently had experience which is selected. Then bracketing is a very important factor in the phenomenology or in all the qualitative research studies, because you cannot mix your own feelings, emotions, and the previous knowledge or assumptions with the participants data while analysis. Next, I told you about the example, that is a qualitative study on the psychological experience of the caregivers of COVID-19 patients. Here in the study, I told you that there were 20 nurses were taken as a participant who were providing the direct care to the COVID-19 patients, and face-to-face interviews were taken from them as they were the first participants from the hospital. And results showed that there were four themes which were emerged. That is, first is about the negative emotions, second is about the self coping styles, and third is about the growth under the pressure. And finally they showed that there is a positive emotion occurred simultaneously with the negative emotions. Then I was explaining about the study which I did for my PhD. That was phenomenological study, which was having a purpose of identifying the factors leading to suicide attempt among the college students in Pune city, where I have taken the students who had attempted suicide and got admitted in the hospital for the treatment. And once they recovered from that, got settled, I have taken them as my participant. The method which I have used is in-depth interviews were conducted with the students as well as their parents, and these face-to-face interviews were recorded using an audio recorder, and the data analysis resulted in the emergence of seven distinct but interrelated themes with the several sub-themes. And the model which I have prepared, that I was showing you, I hope it is visible now.
Yes, ma'am. Yes, ma'am.
Yeah.
It's
Now,
visible.
in this model, what I got, that is, there are seven themes which emerge from the data which I collected from the student. So, first theme was interpersonal conflict. They had some conflict with somebody, like it may be a parents, it may be a spouse, it may be a husband, sibling, or it may be a batchmates, or it may be a teacher. They had some conflict. Second was about the parental behavior. Parental behavior was parental behavior. Next was love affair, lifestyle, family distress, and academic factors, and mental health. So from these major seven themes, what we understood that these all factors are interrelated. They were not a single factor which was causing the suicidal attempt in the student. You know that when in 2010 there was a very high suicidal rate among the college students, it was seen that everyone was blaming the academics, or everyone was blaming to the education system. But when I did my study, that time I found that academics had a very less role in it. I got only few sub themes under the academic factors, like academic failure. That was the student's fault. Then behavior of the teacher, maybe because of that was a reaction from the teacher which was there for the behavior which was shown by the student. Then college environment and peer pressure. But there were many other factors which was causing the suicidal thought among the students. So this comes when we do the qualitative study. For quantitative study, what we would have done, would have just counted the students who are having the suicidal thoughts or who have attempted the suicide, and we would have listed few main points which they have given you, what are the causes of suicidal attempt in them. But there are so many other things which were hidden, which were not seen in the quantitative research, which are seen in qualitative research. So this is about the phenomenological research study. I hope it is clear. Nilima, hello, am I audible? Next we have, that is ethnography. In ethnography, it is a methodology for descriptive studies of cultures and peoples. Ethnographic research is a method of conducting inquiry of a life process by studying individuals, artifacts, or documents in their natural setting. It includes both anthropology and historical forms of research. In healthcare research, and ethnography provides access to health beliefs and healthcare practices in particular cultural or subcultural group. Therefore, ethnographic inquiry facilitates understand about cultural behavior and practices affecting the health of the people. This is a very important aspect in nursing also, as you know that there are some cultural practices which affect the person's health. For example, you know that there is a practice of using the gum in preparing the special laddu for PNC mothers because it is seen that they are rich in calcium. So this is one of the cultural practice in some of the communities that all PNC mothers will receive this. So this is helpful for their health. But there are some harmful practices also present in the culture. So that can be studied under the ethnography. Ethnographers learn about the cultural groups in which they are interested through extensive fieldwork. This is very, very important in ethnography. It has got extensive fieldwork. Ethnographic research is a labor intensive and time consuming endeavor where even months or years of fieldwork can be involved. If you want to study something which is in minute details, then you need to be a part of that community and stay with them for longer period, observe them in their own environment. So that is a field work which is extensive and it takes months to years. A certain level of intimacy with the cultural group members is required to study culture. Unless you become one of them, they will not share everything with you. So that intimacy is required, and that requires to stay with them. Then researchers use themselves as the instruments in these ethnography studies where they spend time with the group members to collect data through informal interactions and observations rather than using a formal tool for data collection.
Yes, ma'am. Okay.
So,
Thank you.
yeah,
Yes,
Nilma, is it
PPT.
visible?
Now it is visible. In between, it will be. Now it is
Yeah,
visible.
there is some problem with the sharing of the screen.
Okay, okay.
So, in ethographers learn about the cultural groups in which they are interested through the extensive fieldwork. That is important, extensive fieldwork. Then it requires the it is a labor intensive and time consuming endeavor because it takes months to years. And so, sometimes you need to be a very close person in that particular cultural group, so you need to have the intimacy with the cultural group. You need to stay with them, you need to maintain a good rapport with them, then only you can observe each and everything. Okay. In ethnography, information on three major aspects of the cultural life is sought in the ethnography studies. First is cultural behavior. What members of the culture do? How do they behave? What kind of role they play? How do they carry on their daily activities? So that is observed. Next is cultural artifacts. What they make. Like for example, you know that Mohenjo-daro, that is one of the particular place where we have got some of the artifacts, like what are the jewelries they were using, what kind of housing they had, how they had planned the villages and the cities, etc. So these are the artifacts from which we had come to the conclusion that there were advanced villages, cities present in the previous era. Then cultural speech, what people in cultural groups say, what kind of language they use, what are the different words they are using as an alternative, etc., is studied under the ethnography. For example, here I have taken this example from our scenario, that is communication and relationship dynamics in surgical teams in the operating room, an ethnographic study. Now, what is this study? They have used the ethnographic method or the research design for studying this particular subject, where they have taken 39 surgical teams which were working in two different operation theaters, where means it is, when we say team, it includes different kinds of personalities. For example, surgeons, then anesthetist, then surgical nurse, then the different team members which are involved in that surgery. So they have taken two operation theaters which were used for for the orthopedic surgeries where the complicated surgeries are done. And they have observed how these teams are having a different culture of communication among themselves. And from that, what they did, there were researchers which were playing the different roles. One used to sit as a not a part of that team, observing them, how they are communicating among themselves, whether they are using the body language to communicate, whether they are using the different kinds of words particularly to communicate the particular event, how they are managing the surgery, how they are communicating with each other, the different aspects of the surgery. So that all things are observed. After that, they have taken an in-depth interview of that particular team members, and then they have analyzed that, and they have come to the conclusion that there were different kinds of communications which they were following, like proactive and intuitive communication, silent and ordinary communication, inattentive and ambiguous communication, etc. So there were different kinds of communications which were used by them to communicate the things related to the surgery and manage the event. Okay, so this is one of the type of ethnographic study which was done in operation theater. Next method we have, that is grounded theory. Grounded theory is an inductive technique developed for the health related topics by Glosser and Strauss. It emerged from the discipline of sociology. The term grounded theory means that the theory developed from the research is grounded or has its roots in the data from which it was derived. The last line is very, very important. How this grounded theory design is different from the other designs. It is an approach to study of social process, social structures, and it is different from other methods because of its specific access and social to theory development. Hello? Am I audible? Is there any problem?
No, 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 ma'am. No.
Because I am getting some noise.
Okay, okay.
Okay, so in grounded theory, what happens? The main aim is preparing a theory out of the data which you have collected. So its root of that theory is present in that particular data which you have taken from the participants. That is the main point. For example, I have taken one example to understand a grounded theory study of the intention of nurse to leave the profession. You know that nowadays people don't want to work as a bedside nurse. They would like to come to the education side or go to the administration side or change the track. Okay, so why this is happening? So they have done one study which is based on the grounded theory. The objective is this study explores the process of the development of an intention to leave the bedside nursing, how that intention has developed in the nurse's mind, that they have explored. So they have taken 21 nurses, and they have taken in-depth interviews from them, and then they have analyzed them based on the grounded theory principles. So what was the result? In the result, they found that there were two important themes emerged from the participant, that is social image of nursing, and next is culture and structure of the bedside nursing. These two important factors causing them to decide to leave the nursing as a bedside nursing. So that's how they have developed this particular theme. That is, these are the two important factors. If you take care of these two important factors in the hospital side, definitely nurses will not think of leaving the bedside nursing. So this was the grounded theory which they have applied in this. Next research design we have, that is historical research design. As the word says, historically, it means about the past. The systematic collection and critical evaluation of the data relating to the past occurrences of a particular phenomenon is done in a historical research. Historical research is undertaken to answer the questions concerning causes, effects, or trends relating to the past events that may shed light on present behavior or the practices. Historical research involves the careful study and analysis of the data about past events. The purpose is to gain a clearer understanding of the impact of the past on present and future events related to the life processes. Historical research typically relies on available data. Data for historical research are usually in the form of written, narrative records of the past, diaries, letters, newspapers, minutes of the meetings, reports, and so on. Now, how it is important for us in as a nurse, what we can use. Important existing data sources for the nurse researchers are hospital records, nursing charts, physicians' order sheets, and care plan statements. They all constitute the rich data sources. So we also can conduct the historical research by using these kind of data. Mainly, this historical researches you have seen in the preventive and social medicine or the community health, where you will find that there are some assumptions or some principles which have come out from the historical studies. For example, we had seen in the preventive and social medicine or the community health nursing that there are number of deaths which occur in the patients who had heart attack before they could reach to the hospital. From the hospital data, we have seen that there are certain rates for the deaths in heart attack patients or the MI patients, but we were lacking the data which was not present in the hospital, which was showing that there are number of deaths which are occurring before the person could reach the hospital, which is highest than the death which occurs in the hospital. So how it has come, we have studied the past events or the past occurrences in the community, and from that we have come to the conclusion that this is happening. Okay, so like that we can have the historical researches done in the hospital side also, community setting also, and even education setting also. So we can study the previous records which are available with us, and from that we can come to the conclusion about it. Next, we have that is action research. This is the most important area for each and every institute. Action research is a form of applied research that tries to empower the people through a process that constructs and uses the knowledge. It tries to find the practical solutions to the problems existing in the framework of an organization. This is most important. It helps you to find out the practical solutions. It increases understanding of how change in one's actions or practices can mutually benefit the nurses within an organization. It helps to solve a problem by enriching the field of application of a discipline. For example, in action research, whatever problems we are facing in the hospital side, we can take that as a research, a mini research, and try to find out the solution for it and apply it. It is also can be used as a evidence based practice. For example, I'll tell you, many times we face a problem of infection control in the hospital, specifically ICUs and the operation theaters. So we can take the small research, just collect the data related to that from the nurses, from the other health team members in the form of qualitative data, and just find out what were the reasons, how we can come out from that, what can be the indicators given to them, what can be the practices we need to change to control the infection. Like that we can have the action research done for the particular problem, and we can get the solution, and that solution should be implemented as a policy for that particular institute. Major drawback of the action research is we cannot generalize the findings. That will be related to only that organization. It cannot have We cannot have the same findings in say other institutes, or we cannot have the same solution in the other institutes. So it depends on the particular institute, what are the practices, what are the problems faced by them, and how they can solve it. Next, we have that is case study method. Case studies are in-depth examination of people, places, or institutions. When we say case study, it doesn't mean that case means only one patient. It can be a similar kind of patients, that is a group of patients. It can be an institution, or it can be a place. So that will be considered as a case. Robson defines case study as the development of detailed, intensive knowledge about a single case or a small number of related cases. This strategy is of particular interest if the researcher wishes to gain a rich understanding of the context of the research and its processes. In our field, we always use this case study method. Case study is often used when the selected case might offer insight into a unique situation, or when the researcher wants to know more about a particular phenomena within a real life context. In nursing sciences, case study methodology is used since a long time for in-depth study of a single patient or a group of patients to generate the knowledge for solving nursing problems of a patient suffering with specific disease condition. Even for our student, we give the case study for a particular patient and we tell them to study the patient in detail as a case. Okay, now in case study method, what we do that is we take the only one patient which is showing a unique features, or we take a group of patients which are showing the similar kind of characteristics. For example, I'll tell you in our pediatric ward, I have seen uh, one child almost 10 years old, which was suffering, who was suffering from the pot spine, which is not common in that age group. You might have seen the pot spine in the adults, but that is also rare. But in that patient, that was a typical case which was showing all the signs and symptoms of the pot spine and having multiple complications of the pot spine. So if you have that kind of unique case in your clinical side, you can take that as a case study and you can do the case study research on that particular unique patient where you will collect in detail information. When we do the quantitative type of study where we have numbers, we count it, how many patients are suffering from the same kind of disease, how many patients are showing the same kind of sign and symptoms, how many patients have received the similar kind of treatment, etc. But whereas in case study, it is an in-depth study of that particular case, which will start from the beginning of that disease condition in that particular person. You'll interview that patient, you will interview the family members, and you will collect the in-depth information about the disease condition, how the progress has occurred in that particular patient. So that whole thing comes as a picture in narration form. So that is called as case study. So we have seen the major designs in the qualitative research design, that is phenomenology, ethnography, grounded theory. Then we have seen the case study method and the action research method. So, what kind of data collection techniques are used in these all methods? There are some methods which are different than the quantitative research methods. First one is individual in-depth interviews. Here we take the individual in-depth interviews not one time. Sometimes if it is required, then we take multiple times interviews. And these interviews are almost longer, for longer period, maybe almost up to 50 minutes to 1.5 hour or 2 hours. So you can imagine that the data which gets collected in that particular period is very large, which we need to transcribe. Transcribe in the sense we need to write word to word how that person has told us, and then we have that verbatim we need to analyze it. Whereas this is not required in quantitative research. Quantitative research is more easier. Then next we have that is focus group discussion. In focus group discussion, we have a group of say 5 to 10 members coming together, and we have a one moderator who will be just stimulating the particular topic for the discussion and observing how the group is discussing and reacting to that topic, how they are contributing to that topic, and that everything will be noted, recorded, or audio tape, as well as audio tape. Then participant observation. As I told you, in some of the research designs, for example, ethnographic research designs, where the researcher needs to be a part of that community, then only he will develop good rapport and the relationship with the group members, and he can observe the things from the closer view. So that is the participants observation is required. Then next we have that is written depiction by the participants. Sometimes, person is not able to verbalize the things. That person uh, will be able to explain you in the writing form. So what you can do, you can give one open-ended question as an opening question and tell that person to narrate whatever his feelings he has or perception he has about that event in the form of writing. And then we have in historical form of research, we need records and reports which are available. So these are the some of the methods which are used in the qualitative data collection techniques. And then we have different methods of analysis in the qualitative research. data. In quantitative, we always write as a demographic variables, as a frequency and percentage, and then we have findings written in the form of numbers, or we have categorized them as a mild, moderate, severe, etc. But in qualitative research design, what we have, it is completely different. It has got a different methods, like whatever data you have collected, maybe in the form of audio tape, you need to first put it on the paper. First, what you will do, you will just listen the records again and again, and you will write that as a transcript. Then that transcript you will read again and again, and just try to understand that what it means by that participant. So for that, you cannot have the many transcriptions together. One by one you have to analyze, and that's why it has to be started from the beginning, right from the first participant's data collection. So analysis starts from the beginning, and once you read that again and again and perceive it, when you go in depth in that particular data, you will perceive the important points from that. Then you will just underline the important statements which are coming in that. Then after that, you will do the coding. From that statements, you have to do the coding. That means what is important in that particular paragraph, that you will write it in the one, you can say it is separately. You have to just take the codes from that particular paragraph, and then after that coding, you have to just find out whether there is any relation between that codes. If there is a relation, you have to just track it, and then you have to write your analysis in the form of text. It is not in the form of numbers. So this is all about the qualitative research studies. This is a bibliography which I have referred for explaining you with the example.
Uh, Thank you so much, ma'am, for the wonderful session. Okay, now the session is open for the audience or participants. Please, if any query, you can ask in comments. We'll wait for 2 minutes, ma'am, for the
Yeah,
questioning.
yeah, sure. I hope the PPT was visible to all.
Yes, yes, ma'am. Now, after the half session, it will be visible,
Arey, you would have
and
told me
it
before
is.
only. Because here it was going on smoothly.
No, that's okay. Okay, okay. But here it's stuck. But now it's okay. After that, okay.
Because when I did as a PowerPoint show, I think it was not moving from your side, but from my
Hmm.
side it was moving.
Yes, yes.
Is there any question in the chat box?
No, ma'am.
No?
Till now. Okay. Okay, so thank you so much, ma'am, for the this wonderful session. I think it's very understandable for the all for the all participant. So, on the behalf of Parul Institute of Nursing, I would like to express my gratitude to you, and also for the accepting our invitation for the webinar. Thank you so much for the sparing your valuable time for sharing knowledge with us. I'm sure that after the session, every participant might have been enriched with the knowledge about the qualitative methods and the very good and the experience example. So it will be a good for us for sharing this type of studies. So like that is the inspiration for us. So like that we can also continue with that. So thank you, and also extend my gratitude to the principal sir and also the Parallel University. Thank you, ma'am, for the wonderful session.
Thank you, Nidima. Thank you so much for your introduction and your principal, sir, and the university also. I thanks again for giving me this
Yes.
opportunity. I hope students will take the qualitative research. Many times it is seen that quantitative research is taken by the student and they get scared of qualitative research. That's why I have taken specifically the examples in this so that they will not get scared. Even nurses
Yes.
can conduct these studies. There is nothing very hard in that. You can conduct the qualitative studies. Only thing that time
Hmm.
during the analysis you need to take some help from the experts. That time you will face some
Yes.
queries or some doubts. Otherwise you can conduct the qualitative study. All the best for all the students. You can take the study related to qualitative
Yes, ma'am.
research. Thank you so much.
Ma'am, just a wait for. There was a question in the live.
Yeah.
Ma'am, can you explain the coding for qualitative research?
Actually, coding, to explain the coding, you require to have the
Huh.
example. I did not give you the
Yes.
handouts. When I conduct the speech,
Hmm.
that time I always give my handout to the student. So, just for your information, coding means what? It has got open access coding and the central coding. There are different types of codings which you need to do. In that, what we do, whatever interview we have taken, that is in the audio form. So what we do, we just listen that carefully and we write word to word. That is, we call it as a verbatim. Now, once you prepare that verbatim, you have to read that verbatim again and again. When you read it, you will find that there are some sentences which are very, very important given by your participant. So you need to underline them. Okay, once you underline that wordings or the statements given by the person, you need to perceive that in what relation that person has given this particular statement.
Yes,
That
ma'am.
relation, it becomes your code. So once you have prepared that code, you need to find out whether there is any relation between the different codes. I'll just tell you with the help of my own this framework which I have prepared. I'll just share one slide.
Okay.
Just a minute. It's not visible. Can you see this now? Yeah, is
Yes,
it
ma'am.
visible? Yeah.
Yes, ma'am. Visible.
Yeah. Just a minute. Now, in this, just see what themes I have formulated. Interpersonal conflict. See, when I was reading the verbatim from the different participants, I came to know that they had some argument with the parent. One person, one first person which I read, I found that that person had a fight with the parents, and so he attempted suicide. Okay. Now, when I started reading the another one, there I found that there is an argument with the husband. So when I read the another one, there I found that there was an argument with the boyfriend, and the another person had with a girlfriend. So, like this, you will find that each verbatim, when you read, you will get some statements related to that. The person will explain you that my father said like this, then I said like that, then there was a fight, and like this happened. So that was argument. So argument with the parent becomes your code. Understood? So like this, each
Yes.
participant will tell the different story. From that, you have to take out the main theme, and then you have to see. I have taken this under one heading, that is interpersonal conflict. Understood? I had a participant which who had argument with parent, argument with husband, argument with boyfriend and girlfriend, argument with the sibling, argument with the teacher. Then because of that they felt insulted, and this all I have connected together and it became the interpersonal conflict. Now next I can explain you about the family distress. In some participants they told that they have a sibling rivalries. when they have a more than two children in one family, they had sibling rivalries. They were fighting for some of the things which somebody has not got. And the another family problem was vices. That means father was drunkard and he used to come and beat the mother or beat the children. So that was a family distress which was causing them to attempt the suicide. Okay, so like this, from the verbatim, from the person who has given you this information, from that itself you have to take out these codes. That is called coding.
Okay.
Understood? I hope
Okay.
it is clear.
Thank you so much. Yes, ma'am. Yes, ma'am. It's a clear. Thank you so much, ma'am. Okay. So now we'll end the session. Thank you so much, ma'am, for the wonderful session.
Thanks again.